To get going. The Senate Health, Education, Labor, and Pensions Committee will please come to order. Today we are holding a hearing with Secretary of Health and Human Services Xavier Becerra, Secretary of Education Miguel Cardona, and on how we can help schools across the country as they work to safely reopen for in-person learning. Ranking Member Burr and I will each have an opening statement, and then I will introduce our witnesses, and after they give their testimony, senators will each have 5 minutes for a round of questions. While we are again unable to have this hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov, and if you are in need of accommodations, including closed captioning, you can reach out to the committee or the Office of Congressional Accessibility Services. This pandemic has been incredibly hard on students and families and educators. For over a year, many students were not able to see their teachers or friends or counselors or coaches. Students with disabilities could not get the support they needed. Many students from families with low incomes could not get nutritious school meals. And students without internet at home were left struggling to keep up with the shift to remote learning. Every student's learning was disrupted in some way, and educators and school leaders found themselves trying to meet students' needs through a screen, making their already challenging jobs even tougher. I heard from so many families in Washington State about these challenges and how devastating this crisis has been. My goal since the start of this pandemic has been to get students back in the classroom safely for in-person learning, and I know that has been shared by members of this committee on both sides of the aisle. And while no one thinks our work is done, we have fought to make our goal a reality by working to get relief straight to schools over multiple relief bills in 2020 and critically in the American Rescue Plan last March. This funding has allowed schools to take steps to keep their students safe, like providing masks and tests and improved ventilation, to keep students connected, like making sure they have access to technology and the internet, to accelerate their learning, like offering summer learning and high-quality tutoring, and to help them navigate this incredibly tough time, like increasing mental health resources. And now, according to the CDC, 96% of K-12 public schools are offering full in-person learning. But as the Delta variant has shown us, this pandemic is far from over. We saw nearly 1 million new COVID cases among kids over the past 4 weeks. Pediatric hospitals across the country are running out of beds. And according to CDC, we've seen over 1,800 school closures this school year related to COVID outbreaks, meaning children had their learning once again interrupted and parents had their work plans upended as they needed to take care of their kids. Families are exhausted. Everyone wants to get back to the classroom and stay there. But to get there, we have to continue working to keep students safe. And look, we have more than a year's worth of data now. Public health experts like those at the CDC and in-state and local health departments have made clear what works: masks, ventilation, physical distancing, testing, and getting everyone vaccinated who's eligible, which is especially important to protect children under 12 who cannot yet get vaccinated. And finally, flexibility. In other words, ensuring school districts have plans to provide high-quality distance learning to all students when necessary to keep them safe. The work the Biden administration has done to promote common-sense public health measures is so important. It's been a relief to have leaders in charge who set an example that public health and safety should not be partisan. It should be part of what you do to protect yourself and to protect others. And I wish every elected official took the same approach. Unfortunately, in too many parts of our country, the basic steps that could keep students and educators and communities safe have been politicized, so much so that instead of promoting basic steps like wearing masks in schools, some Republican governors and state legislators have been trying to outlaw them. Schools have been pushed to this brink by this pandemic, but instead of giving them help, those Republican governors and state leaders are threatening school funding, banning mask requirements, and undermining efforts to get people vaccinated. They're not only ignoring and in some cases denying the fact that we are in a pandemic, they are making denial a badge of honor. Let's be clear, there is nothing honorable about putting kids and educators and their families at risk to score political points. and the risk is real. New data from CDC confirms schools without mask requirements are 3.5 times more likely to have a COVID outbreak, while COVID case rates in school districts with mask requirements are half that of those without them. For anyone truly concerned about public health and safety, there should be no question about putting that real-world data into practice, because this is not a game to the school leaders who are being threatened and harassed for doing the right thing. It's not a game to students who want to be able to go to school without contracting a deadly disease that could hurt them or a family member who's immunocompromised or a sibling who's too young yet to be vaccinated. And it is not a game to parents who want to be able to put their kids on the school bus without worrying they are putting their child at risk. They are counting on policymakers to take this pandemic seriously. Now, looking down the dais here today, I know there are a lot of perspectives on COVID-19 represented here, but I hope all of us can send a message that the basic public health measures we need to help kids keep safe and learning in school should not be political. They should be American, because we still have a lot of work ahead to get our schools and students through this pandemic, and we've got to do it together. Everyone eligible who has not gotten vaccinated should get their shots. States and localities need to keep following the science and doing what works to keep kids safe and learning in school. The Biden administration needs to continue to build on the progress made so far to promote vaccinations, increase testing capacity, and make sure schools and districts have the guidance and the support they need to spend those funds. And our work will not end when this pandemic does. We will all have to work together to repair the damage COVID-19 has done, address students' academic, social, emotional, and mental health needs, and help our schools build back stronger and fairer. That means addressing the sharp drop in enrollment this pandemic caused, the sharp rise in mental health issues among kids, and the fact that COVID has set many students' learning back significantly, particularly students whose families earn low incomes, students of color, English learners, and students with disabilities. It also means addressing the inequities and systemic racism that have long plagued our education system and have made this pandemic so much harder on so many students. So today I look forward to hearing from both of our witnesses on these challenges and working with them and with the President to help students, parents, educators, and schools across the country get through this crisis. With that, I will turn it over to Ranking Member Burr for his opening remarks.
Thank you, Madam Chairman. Good morning. Let's start with some good news. For the most part across the country, children are back in public schools. That's not really new for private schools, which mostly stayed open during the highs and lows of the pandemic. But public schools have now taken steps to ensure that students and teachers are able to get back to school and back safely. These are based on lessons learned from schools that stayed open during the pandemic. For example, a study out of Duke University and UNC looking at North Carolina school districts showed that in-person learning can continue with minimal transmissions of COVID by being thoughtful, having a plan, taking common sense steps to make students and teachers safe. More good news. Thanks to Operation Warp Speed and the development of vaccines, most teachers are vaccinated, though that number needs to get higher. And now that boosters are available for workers in high-risk settings who got the Pfizer vaccine, I hope teachers will get the booster as well. Hopefully, individuals who receive Moderna and Johnson & Johnson vaccines will have information on boosters soon. Even more good news. We now also have vaccines for children 12 and up. Also, Pfizer reports that they have good data on a lower dose of their vaccine for children age 5 through 11 and have submitted that data for FDA review. It's my hope that we'll have a vaccine for children under 12 very soon. And good news continues with therapies. We have at least 6 effective treatments for those who get COVID, and more treatments are on the way, unless, of course, this Congress were to pass legislation that imposes price controls that kill the incentive to innovate and explore science so more treatment and cures can be developed. I've said from the very beginning of this pandemic that vaccines and therapeutics are going to be our way out. We've seen the power of these vaccines and treatments, and we all have a responsibility to do what we can to turn the tide on this pandemic. I continue to encourage every American who's eligible for a vaccine or a booster shot to get it without delay. While all of that is good news, the administration needs to do a better job getting therapeutics approved and working with the industry to increase supply of therapeutics that work. Now for the bad news. We're here today to hear from the Biden administration's Secretary of Health and Human Services and Department of Education about their efforts. Gentlemen, welcome back to our hearing room. The President has said that opening school is a national priority. I agree. As his cabinet members for health and education, the responsibility falls squarely in your hands to develop the federal response and help state and local leaders have the tools they need to keep schools open and students and teachers safe. But I'm very displeased that your staffs have failed to live up to the commitment you both made to me privately and publicly to be responsive to my oversight requests. On August 25th, I sent you both letters asking a series of questions I received from students, parents, teachers, school administrators, and public health officials from my state, from people across the country, as well as many of my colleagues on both sides of the aisle in Congress. I received a thoroughly inadequate response yesterday, less than 24 hours before this hearing. Gentlemen, congressional oversight is not an option. These questions were simple. There were no tricks. In fact, this letter was aimed at helping you inform this committee about what was happening around the country as schools were already in the process of welcoming students back in the classroom when I wrote the letter. In many places in the country, we're almost 2 months into the school year. So this really isn't a back-to-school hearing. It's a back-in-school hearing. In many places in our country, we share goals as to how to help school districts stay open, which is why I sent the letter in August. I asked about the $97.8 billion in testing money that was made available to HHS to learn how it was being administered, how schools were able to access this massive amount of money, and whether Head Start would have access to the money, and how we were accounting for the testing needs of private schools in your plan. Of course, as schools are still asking about testing, it seems you have failed to communicate to them how to access these dollars. I ask about the supply chain of tests and your testing strategies because people still cannot access rapid tests when stores are out of stock and people go back to waiting days for testing results. You've squandered the gains we've made in scaling up the capacity last year. I also asked about the $190 billion in funding for our schools and why 92% of that money still remains unspent. You can't have it both ways. Either the money was urgently needed and should be spent quickly, or schools don't need the money and it should be reallocated to other priorities tied to COVID. This isn't a slush fund for unrelated priorities of future needs. I also asked for a snapshot of basic data about infections, breakthrough cases, hospitalizations, and fatalities, so we could have a clear picture of what's happening on the ground. You should have easy access to that data. There's no reason not to respond in a timely manner to share with me and this committee. I asked about the availability of therapeutics for children to help ensure that children who get COVID have access to life-saving treatments and that parents and health professionals know about those in advance. I asked about the scientific evidence behind masks because the more you can share sound science and data, the more you can use that to persuade people that science exists. When you resort to pounding the table, quite frankly, you're losing the argument. Which brings me to the inappropriate use of civil rights law by the administration, which further politicizes the issue and ignores the importance of state and local policy decision-making. I believe that your civil rights investigation into states that have banned masks is counterproductive. The theory behind it is unwise, and the potential for abuse of our bipartisan civil rights laws causes grave harm to all of us. If you want to use the bully pulpit to encourage masks, or you want to use the bully pulpit to criticize and condemn those who have banned mask mandates, that's the perk of your job. Developing preposterous legal theories and abusing the powers you have to try to bully your political opponents into submission is a step too far. I turn to you for your agency's help in developing clear and consistent answers to questions from my constituents, people around the country, and more importantly, my colleagues who will vote on what that pathway is in the future. Waiting for over a month for a reply is not acceptable. This is the first time either of you have appeared before our committee since you were confirmed. If you aren't going to respond to oversight letters in a timely fashion, we certainly can't wait 6 months for you to reappear before this committee again to answer critical questions from the American people. Maybe we should just ask you to appear before us once a month until the pandemic's over so that we make sure we're getting responses to these and other vital questions in a timely fashion. The reason I raise the importance of our oversight work is that it helps to inform us where to go legislatively. As we transition into the fall and winter, students and teachers will be spending more time indoors. We will likely see more cases of COVID, flu, and other respiratory illnesses, and we'll need to determine how to manage a potential surge in the demand for testing and treatments that will come with the holiday season. We need a clear, straightforward strategy of what must happen in the next 60 and 90 days and beyond, so Americans don't have to spend another holiday season apart from their friends and their family. Last week, some of my colleagues and I wrote Jeffrey Zeitz to ask about the administration's strategy, and I hope to get a more timely response from him than I have from the two of you. Finally, I need to take a few moments and confront the skunk at the picnic. The reckless tax and spend agenda of partisan majority is threatening to tear apart this Congress and the country. You have the barest of majorities, just 3 seats in the House, only the Vice President breaking a tie in the Senate. Do Republicans get the role of chair and Democrats the role of chair and Republicans the role of ranking? It's not the moment for grand and sweeping legislation to reshape every aspect of the American family on your own. It's unconscionable to take issues in this committee's jurisdiction, propose to spend $723 billion on these priorities without a hearing, without a markup where we can offer amendments, without consulting anyone outside of those writing this terrible piece of legislation about the real-world effects of these proposals on faith-based providers, on small mom and pop child care providers, on the cost of college and state oversight of community colleges. If you succeed in ramming through partisan legislation like this, Republicans and Democrats may no longer be able to agree on higher education, or child care, or national service, or even public health. Bipartisanship means getting some, not all of your wish list. Bipartisanship means having to accept the other side may have some good ideas. We reach on easy compromises here. We work ideas out so that more, not less, of the elected members of Congress, the representatives of the American people, can say yes. It's sometimes slow, it's frequently messy, but it brings about unity and lasting change that is supported by the American people. If that's not the goal, I don't know why any of us are here. Madam Chairman, I yield back.
Thank you, Senator Burr. I will now introduce today's witnesses. Today, the committee will hear from Xavier Becerra, Secretary of Health and Human Services, and Miguel Cardona, Secretary of Education. Secretary Becerra, Secretary Cardona, thank you both for joining us today. I'm very pleased to welcome you back before this committee, and I look forward to your testimony. Secretary Becerra, we will begin with you.
Chair Murray, Ranking Member Burr, it's a pleasure to appear before you alongside Secretary Cardona. At HHS, the health and safety of our students, their families, and our school personnel is our top priority, always, not just during a pandemic. COVID has robbed so much from our children: a safe and comprehensive learning environment, a normal school year, time with mentors and friends. For some, the costs have been even greater. Roughly 40,000 children have lost a parent to COVID-19, and more than 1.5 million have lost a caregiver. The numbers only tell part of the story. It's the empty chair at the dinner table, the open seat in the bleachers. It's the quiet homes and crowded hospitals. It's not having the chance to say goodbye. That's the real story. We owe it to our children to make the classroom as safe, nurturing, and instructive as possible. Every step we take and take together can save lives. That's our mindset at HHS. Thanks to President Biden's leadership and robust funding from Congress, our department has made critical investments in COVID mitigation to help schools stay open safely. We've learned a great deal in 18 months. Vaccination, masking, testing, increased hygiene, distancing, and improved ventilation all can significantly reduce COVID-19 transmission when layered appropriately. And make no mistake, vaccinating Americans against COVID is the most effective prevention strategy for our schools. The science is clear. I call your attention to Chart 1. While the COVID-19 rate for children has increased nationwide, data from August show that children and adolescents in low vaccination states are being hospitalized at 4 times the rate of their peers in high vaccination states. Add in data for adults, and the lesson is undeniable. As you can see from Chart 2 today, COVID is attacking our children, our least vaccinated population, at rates even greater than adults in states with low vaccination rates. That's why this administration is taking several steps to turn the Delta variant tide. HHS will require the nearly 300,000 educators at Head Start programs to be vaccinated. Our Centers for Disease Control and Prevention, CDC, is working with partners to broadcast the importance of vaccinating children, teachers, and school personnel. HHS is also coordinating a public education campaign that lifts up more than 14,000 trusted community voices to remind everyone that vaccinations are safe and effective. Our Food and Drug Administration has reaffirmed it will follow the science on COVID-19 vaccines for children younger than 12. The agency is working around the clock. I'm hopeful that pediatric COVID-19 vaccines will become available in the coming months for children 5 to 11 years of age. Our National Institute of Health, NIH, is working to get parents and care providers the data they need to make good decisions for their kids, both today and for the long term. And thanks to the American Rescue Plan, community health centers have administered nearly 500,000 COVID vaccines to 12 to 18-year-olds and conducted more than 2,500 vaccination events at school-based clinics, mobile vans, and pop-up clinics. Testing is another cornerstone of our strategy. In April, HHS provided $10 billion for screening testing to help schools reopen safely, and more than $2 billion to scale up testing in underserved populations. We partnered with the Department of Defense to make $650 million in investments to expand testing opportunities for K-8 schools and underserved congregate settings. Masking has also shown extraordinary results. On September 24th, CDC published data that show schools without in-school mask requirements were 3.5 times more likely to have a COVID outbreak than schools with an in-school mask requirement. The pandemic is not only taking lives, it is devastating our kids' mental health, and we're not waiting to act. In May, HHS announced $14 million from the American Rescue Plan to expand access to mental health care by integrating telehealth services in pediatric care. We've made the largest investment ever in mental health and substance abuse block grants to states. And in August, our Substance Abuse and Mental Health Services Administration, SAMHSA, announced additional grants to strengthen resources for our nation's youth. This is just a snapshot of our efforts. Over the past 6 months, I've met with parents and teens in Georgia, visited the tribal leaders in Seattle, and farm workers in California's Central Valley. I met with faith leaders in Oklahoma, families in Dallas, health workers at hospitals in New Orleans. Madam Chair, I've seen firsthand the resilience of our people. They are counting on us to keep their children, tomorrow's leaders, healthy and educated. But as Robert F. Kennedy reminded us, their future is not a gift or a guarantee. It is an achievement. I appreciate your support for HHS through this crisis, and I'm committed to working with all of you to achieve the healthy future for our children, and it's what they deserve. Thank you.
Thank you, Secretary Becerra. I will turn it over to Secretary Cardona for a statement.
Good morning, Chair Murray and Ranking Member Burr. I'm honored to be alongside my colleague and friend, Secretary Xavier Becerra, speaking about the critical work of safely reopening our nation's schools for in-person learning. President Biden made it clear on his first day that getting all students safely into the classroom is a top priority. That has been my priority as well. I'm proud that the vast majority of America's 50 million students are in school full-time, learning in person. Schools are the heartbeat of communities. They're like second families to students and staff. They're thrilled to be together again. In many areas, schools are the only place where students have access to STEM laboratories, music and theater, gymnasiums, social services, and nutritious meals. Especially amid the pandemic, schools also empower parents and caregivers to get back to work and access the vital services that they need themselves. Last week, I visited 5 states and 11 cities during the Department of Education's Return to School road trip. I saw sheer joy, the joy that students and educators feel about being back together, learning in person. My team and I saw students reconnecting with friends in band practice, on the basketball court, in the classrooms, and yes, even in the cafeterias. The Biden administration has worked hard to help make that a reality. Schools are the most effective means of ensuring students receive the academic, social, emotional, and mental health supports they need to thrive. First, the American Rescue Plan, or ARP, has been a historic lifeline. Our education system didn't serve all students well before the pandemic, particularly students of color and students from low-income backgrounds. With $130 billion, ARP is empowering states, school districts, and educators to safely reopen schools and address education inequities that COVID-19 highlighted and in many cases made worse. But these funds are just the first step. At the Department of Education, we're a service agency. We're supporting districts to implement ARP funds and sharing best practices. We released multiple resources and have convened conversations with education leaders to provide tailored support for schools and districts. We spent a lot of time listening. Our work is far from over, but we have seen great progress. When the Biden administration took office, 23% of K-8 schools were operating fully remote. By May, just 2% were remote. I'm proud to say that we're going to be launching a data dashboard soon where you can see reopening data throughout the country in real time. Currently, about 96% of school districts are fully reopened for in-person learning. Only a handful are utilizing hybrid or remote models for brief periods to contain the spread of COVID-19. While we must stay vigilant, I'm proud to say that despite an increase in a variant of COVID-19 about a month before school started, America is back to school. Moving forward, we'll promote health and safety in schools, we'll support students' social and emotional needs, and we'll accelerate students' academic learning. On health and safety, we know mitigation strategies work. The data is proving that. We cannot risk another year of shuttered classrooms and canceled sports performances or extracurricular activities. We owe it to our students and we owe it to our families to follow the science and implement evidence-based mitigation strategies in our schools, such as masking and physical distancing. Regarding our students' social and emotional development, they've suffered enough. Students' wellness must be factored into the reopening. School districts are determining their students' needs and hiring social workers and school psychologists and implementing new mental health supports. And finally, we're assisting school districts in their work to address lost instructional time. Not only as an educator, but as a father, I can tell you that learning in front of a computer is no substitute for in-person learning. Districts are using ARP funds to invest in tutoring, extended learning time, and much more. Despite the adversity we faced, I am more optimistic about the future of education than ever before. I've seen teachers face unprecedented challenges with determination, creativity, and an unwavering love for their students. I've seen families come together to support the education of the children. I've seen education leaders make tough decisions knowing that they're not always going to be popular, but they're putting the students' needs first. And I've seen students flourish. Their resilience is our inspiration at the Department of Education. States are using ARP to build back better. The education system we had before March 2020 is not the goal. We can and we must do better. Thank you, and I look forward to your questions.
Thank you very much, Secretary Cardona. We will now begin a round of 5-minute questions, and I ask my colleagues to please keep track of the clock and stay within those 5 minutes, and I'll begin. Secretaries Cardona and Becerra, it has been a challenge over the last year and a half to know how to keep ourselves and our families safe, especially when it comes to our children in schools. Some states and localities are following the science and public health guidance and putting in place safety measures. Others are not. In fact, in some schools, basic measures to keep students safe are prohibited by extreme Republicans politicizing masks and vaccines. A recent survey showed the majority of parents of color needed ventilation in classrooms, vaccinated teachers, social distancing, masking, and COVID-19 testing in place to feel safe sending their children to school in person. Yet we know these things are not happening consistently for our families. I think it would be helpful for parents and families to hear straight from each of you the following. 1, when should a child wear a mask? And what additional measures should schools be taking to keep kids safe? Secretary Cardona, I'll start with you.
Thank you for the question, and we share that goal to make sure that we're building confidence in our schools so if parents feel comfortable sending their children, all children. And it's been very clear, we have a year's worth of experience doing this already. Not only at the state level, before we had vaccines, before we had the testing protocols, before we had a year's worth of experience, we were safely reopening schools because we followed what works. And I'll tell you, I'll start off by saying it's really important as educators that we work really closely with our health experts, like we're doing at the department with HHS, CDC, and our U.S. Surgeon General, to make sure that we're listening to medical experts when we're making decisions. Masks prevent the spread of COVID-19. And in schools that have high spread, which we're seeing across the country, it's critically important that masks are being utilized. The promotion of vaccinations for students that are eligible is critically important to reduce spread and make sure that the illness isn't serious if students do contract COVID-19. Quarantining when students are do have COVID or were exposed to someone that did until they are able to get tested, that's critically important. Our schools must be safe for learning, and we have to make sure we're communicating what we're doing to keep students safe. It's our responsibility to follow the science, as my colleague here, Secretary Becerra, has shown. In places that do follow the mitigation strategies, we're able to keep students in the classroom without disruption. It's our responsibility to keep our students and our staff safe.
Secretary Becerra.
Madam Chair, the evidence is spoken. The science is clear. Vaccines are the safest, most effective route to keeping our kids safe. Even if you're under the age of 12, it's still important for everyone who can vaccinate to keep everyone, including our children under the age of 12, safe. Masks, the Arizona study showed very clearly, those places that don't use masks in school are 3.5 times more likely to create an outbreak in the school than those schools that do use masks. As Senator Burr said, it's common sense. None of us here probably would enter a car and start driving without buckling up. 50 years ago, some people protested using seatbelts. Today we don't. We know how safe and effective they are. Same thing with vaccines, same thing with masks, same thing with social distancing, same thing with better ventilation, same thing with better hygiene. We know what works. It's common sense. And I would just tell each and every parent, please use common sense. Don't let anyone stop you from protecting your kids.
Thank you to both of you. You know, since the early days of this pandemic, I've been very focused on making sure testing is widely available as a tool to prevent and respond to outbreaks. And I was, as you all know, frustrated at the Trump administration's failure to articulate a testing strategy and address supply shortages and communicate clearly and effectively. I've pushed very hard to make progress on that front. I know the Biden administration moved quickly to fix many of the early issues with testing, but I want you to know I am troubled, however, by the continuing testing challenges, which includes some schools not having access to enough tests right now. We know testing would be a critical part of safely reopening schools, especially for those students who are too young to get vaccinated. So, Secretary Becerra, I wanted to ask you, what specific steps is the federal government taking to make sure tests are accessible to schools, and what guidance is being provided to make sure they are being used effectively?
Madam Chair, first I want to make sure it's clear. There is a supply of test kits available. It's that the demand has grown dramatically, and the demand for certain types of tests, so that the distribution has been difficult to get to certain places. But generally speaking, nationwide, there is sufficient total testing capacity across the nation to meet our needs. And this includes the combining of all lab-based, point-of-care, and over-the-counter testing. What we have done, well, you're probably aware that earlier this month, President Biden announced the use of the Defense Production Act so that we could procure some $2 billion in rapid point-of-care tests and over-the-counter at-home COVID tests. We are going to continue to mobilize and work with our industry partners to make sure that we can get into contracts that allow for multiple testing manufacturers to expand production. And we are actively engaged with states to mitigate supply chain constraints while the domestic manufacturing expands to meet the demand. But we've seen in the last few months demand increase month over month some 300 to 650%. And it's been a demand that's not been evenly spread, and that's why you see pockets where people say there's a shortage. There is sufficient supply. It's just getting it to the right places and coordinating well.
Thank you. Senator Burr.
Thank you, Madam Chairman. Again, I welcome the secretaries this morning. Secretary Becerra, you had an enterprise in the U.S. government that incorporates many of the agencies that drive COVID policy in this country. Let me ask you, are you supportive of a mandate for COVID vaccines for 12-year-olds and over in K through 12 education?
Senator, thank you for the question. This administration, from the president on down, has been very supportive of moving forward with requirements to make sure that our people are safe.
This is a very specific question. Do you support mandating that 12-year-olds and over in K through 12 be vaccinated?
Senator, again, if you ask me the question as a Secretary of Health and Human Services, I can tell you that my jurisdiction does not include schools and requiring 12-year-olds.
You represent an enterprise that drives all of the policies that go into COVID. Does the HHS Secretary, is he supportive of mandating that K through 12, 12 years and over, that they mandatorily be vaccinated?
I am very supportive, both personally and as Secretary of Health and Human Services, of a school district, of a local jurisdiction, of a governor that says it is time to keep our kids in school safe, and we will therefore move towards requiring masks or vaccinations.
But
I very much support
but not the federal government.
The federal government doesn't have jurisdiction to tell schools what to do, Senator.
Okay. Secretary Cardona, do you believe that parents ought to control whether their children are vaccinated and whether they're have input into what their children are taught in K through 12?
Thank you for the question, Senator. I do believe the role of educating students should involve parental involvement, and I do believe that schools are adequately able to engage parents through that process.
Now, you do support mandates on 12-year-old and over in K through 12 because you and I had a conversation on the phone on that.
I support efforts that states and districts are doing to protect students and staff so that they can continue with in-person learning.
Does that mean you're opposed to a federal mandate of children 12 and over in K through 12, a federal mandate that would require all of them to be vaccinated?
I believe that the decision about mandating should be at the state and local level, and I support the efforts being made to promote vaccines and require them in places where we know spread is high. In fact, the data show that in places where the vaccination rates are highest, there's less interruptions in learning, and the goal is to safely reopen schools, but also to keep them open.
Both of you have put great emphasis on the data that's behind the decisions you make. Secretary Becerra, the President made an announcement on August the 18th that boosters would be available on September 20th for all Americans. Clearly, he was out in front of the scientific data. Why would we set an arbitrary date and tell the American people you'll all get a booster if you've gone 8 months past your initial boost?
Senator, I think the President has been very clear throughout. He believes in vaccinating America, and he believes that he should be vaccinated as well. When he mentioned September 20th, what he was telegraphing to the country is, get ready. We're going to start vaccinating, getting that boost as soon as we can. Of course, the science will drive the ultimate result, as we have seen. And
well,
so,
you've got 5 agencies under your leadership. CDC, FDA, Surgeon General, NIH, NIAID. And they all wrote a letter. They all signed a letter. Let me just read to you what it says. We are prepared to offer booster shots to all Americans beginning the week of September 20th and starting 8 months after the individual second dose. There's no clarifier in this.
Senator, I think if you read the rest of the letter, you'll see that it does put a qualifier saying subject to the science.
Secretary, one of the challenges that we have today is that the communications message is so muddled that the American people don't know what to believe and what not to believe. In large measure, because one can interpret this as a decision was made before the scientific data was available. What if the scientific data had not come out on the 20th? What if a decision could not have been made then? I think we share a bipartisan belief that we've tried from the beginning to follow the science. Secretary Cardona, I'm concerned that taxpayers and lawmakers will never know what the $191 billion appropriated for K through 12 pandemic relief paid for. According to the information my staff received from the Department of Education as of September 10th, K through 12 schools spent $18 billion, less than 10% of the $191 billion of federal coronavirus emergency relief money appropriated at the end of March. And GAO reported that the department's current method to track funding will not let lawmakers know how these funds are being used to address pandemic-related needs of children, and the department agreed to do something about it. What have you done?
Thank you, Senator. The funds that were provided for our schools are really funds provided for our students to help them recover, and I've seen firsthand in my visits to states the creative ways districts are re-engaging students and reconnecting those school communities. As a former commissioner of education, I can tell you firsthand, states are going to first use their ESSER 1 money. But we also know that this is the path to recovery from the pandemic and from the impact on children is going to take more than 1 year. We do have a data dashboard on the drawdown, and we're going to continue to get information on that. We have an outreach team that works directly with our states, not only to learn what they're using the funds on, but also to share best practices. At the end of the day, our educators have been heroes to protect our students and get them safely back in the classroom, and they're also assessing what the needs are of our students. And again, last week alone, I saw tremendous innovation to make sure that we're not only assessing what students lost in terms of instruction, but also meeting them where they are with their social emotional needs and ensuring that our schools are safe, which includes new ventilation systems, which I saw in DeKalb County, Georgia, and in other places that I visited. I'm completely confident and I trust that educators are going to put the children's need first, and they're going to make sure that this recovery provides long-term solutions for these students, not only to get to where they were, but to thrive higher than ever before.
Thank you, Chairman.
Thank you. Senator Casey.
Thank you, Chair Murray. I want to thank our witnesses for your appearance today and your public service.
Thank you.
I wanted to ask, and maybe I'll get at least a big question to each of you, Secretary Cardona on students with disabilities, Secretary Becerra on behavioral health in schools. I just want to put one fact on the table again, that Secretary Cardona, in your testimony, your written testimony on the first page, you say, January, when the Biden-Harris administration took office, 23% of all K through 12 schools were operating fully remotely, 23. By May, just 5 months, less than 5 months into the administration, the percent of all K through 12 schools operating fully remotely had dropped to 2%, from 23 to 2. So that's good news. I think it's directly related to dollars that the federal government's provided. To date, over $189 billion to schools. And I know for the record, the rescue plan was 122 of that 189. So 2/3 of the dollars appropriated were done through the rescue plan that Democrats passed. Secretary Cardona first, I wanted to start with students with disabilities. About 7 million, as you know, in the nation, students in public schools receive special education services. It's an understatement to say that the pandemic has been challenging for those students. Most of them had to adapt to online instruction. Others had to have their related services, such as physical or occupational therapy, reduced or adapted. So many challenges that we've read about. Individual education plans, which, as you know well, are required by the IDEA Act from years ago, often require specific therapies and specific services. So here's the question. Can you tell us what guidance and resources the department is providing to states and local school districts to get students with disabilities the services and the therapies that they need to set them up for success?
Thank you for that question. It's clear that our students with disabilities were greatly impacted during the pandemic, and I recall stories of, I recall conversations with parents who shared with me the impact that their child not being able to access in-person learning had, not only on their learning, but on their entire family. With regard to work, it was much more difficult for many students with disabilities to learn using a laptop. I recall a mother who wrote a book and called it "There Is a Rainbow." And at the end of the rainbow in this book was the school reopening. Her child has autism, and the remote learning, as much as educators did the very best, it wasn't the same. So we need to place special emphasis on our students with disabilities and their families to make sure that they're coming back into a welcoming environment, one that's assessing where the children are now, not where they were in March 2020. We required states to ensure that IEPs are being updated for this school year. And many states understood this important responsibility and did it in the spring so that they can start the year off where the children are now. We know individualized education plans are the best strategy for these students to reach their potential, and updating those is critically important. Furthermore, Senator, from February, we were providing handbooks, and special attention was given to supporting students with disabilities and also supporting educators that serve students with disabilities with training and helping them have more opportunities to understand the social and emotional impact of our students with disabilities. So we understand the priority it is. We're going to continue to serve our educators and our students and our families with children with disabilities.
Thanks very much. Secretary Becerra on behavioral health, obviously a lot to talk about. Let me just make a quick reference to the question. What resources are now available for both excuse me, for teachers and school administrators to support students' mental well-being during this time?
Senator Casey, thank you for the question. I know this is a priority for you. We have made the largest investments in mental health and substance use disorder in the history of these programs because of the American Rescue Plan that you and others in this Congress passed. And I am pleased to say that close to $1 billion has gone out so far to support the mental health services that are needed throughout our country, including in our schools. And we have put out close to $5 billion for substance use disorder services. Most of that money, as you are aware, is administered, run through the states, then they feed it over to the local governments and the schools. And so we have done more because you all passed the American Rescue Plan than we've ever done before, and we know we have to do more.
Thanks so much. Thank you, Chair Murray.
Thank you. Senator Paul.
Mr. Becerra, are you familiar with an Israeli study that had 2.5 million patients and found that the vaccinated group was actually 7 times more likely to get infected with COVID than the people who had gotten COVID naturally?
Senator, I'd have to get back to you on that one. I'm not familiar with that study.
Well, you think you might want to be if you're going to travel the country insulting the millions of Americans, including NBA star Jonathan Isaac, who have had COVID, recovered, look at a study with 2.5 million people and say, well, you know what? It looks like my immunity is as good as a vaccine or not. And in a free country, maybe I ought to be able to make that decision. Instead, you've chosen to travel the country calling people like Jonathan Isaac and others, myself included, flat earthers. We find that very insulting, goes against the science. Are you a doctor or a medical doctor?
I've worked over 30 years on health policy.
You're not a medical doctor. Do you have a science degree? And yet you travel the country calling people flat earthers who have had COVID, looked at studies of millions of people, and made their own personal decision that their immunity they naturally acquired is sufficient. But you presume somehow to tell over 100 million Americans who have survived COVID that we have no right to determine our own medical care. You alone are on high, and you've made these decisions, a lawyer with no scientific background, no medical degree. This is an arrogance coupled with an authoritarianism that is unseemly and un-American. You, sir, are the one ignoring the science. The vast preponderance of scientific studies, dozens and dozens, show robust, long-lasting immunity after COVID infection. Even the CDC does not recommend measles vaccine if you have measles immunity. The same was true for smallpox. But you ignore history and science to shame the flat earthers, as you call them. You should be ashamed of yourself and apologize to the American people for being dishonest about naturally acquired immunity. You want more people to choose vaccination? So do I. You want to lessen vaccine hesitancy? So do I. You want to have that happen? Quit lying to people about naturally acquired immunity. Quit lording it over people, acting as if these people are deplorable and unwashed. Try persuasion instead of government cudgels. Try humility instead of arrogance. Try freedom instead of coercion. But most of all, try understanding that there's no more basic medical right than deciding what we inject into our bodies. Today, after hearing that millions of people in a study show without a doubt that there's a great deal of immunity from getting it naturally, do you want to apologize to the 100 million Americans who suffered through COVID, survived, have immunity, and yet you want to hold them down and vaccinate them? Do you want to apologize for calling those people flat earthers?
Senator, I appreciate your question and appreciate that everyone has their opinion. We follow the facts and the science at HHS. We use the expertise of the medical professionals, the scientists at HHS to make decisions. It's a team effort, and we rely on what is on the ground showing us results.
Except for the dozens and dozens of studies. In fact, most, if not all of the studies show robust immunity from getting the disease naturally. The CDC says if you've had measles and have immunity, you don't have to be vaccinated. The same was true of smallpox. You're selectively doing this because you want us to submit to your will. You have no scientific background, no scientific degrees, and yet you aren't really concerned about 100 million Americans who had the disease. You just want to tell us, do as you're told. That's what you're telling us. You want to mandate this on all of us. You're going to tell us if I have 100 employees, you're going to put me out of business with a $700,000 fine if I don't obey what you think is a science. Don't you understand that it's presumptuous for you to be in charge of all the science? Have you ever heard of a second opinion? I can't go to my doctor and ask my doctor's opinion. I mean, this is incredibly arrogant, combined with this authoritarian nature that you think, well, we'll just tell all of America to do what I say, and they better, or we'll fine them, or put them in jail, or not let them go to school, or not let them travel. The science is against you on this. The science is clear. Naturally acquired immunity is as good as a vaccine. The Israel study actually showing it better. This isn't an argument against the vaccine, but it's an argument for letting people make a decision who already have immunity. You're not willing to consider natural immunity?
Senator, our team has reviewed every study that's out there on COVID, whether it's from Israel, from the U.S., or wherever else. They have used the facts that have been provided through the rigorous research that's been done to reach conclusions. 660,000 Americans and more have died because of COVID. We're trying to do everything we can to save as many as possible. We're using the facts, we're following the science, and following the law.
Nobody's arguing the severity of this, but you are completely ignoring the science on natural immunity. So's Fauci, so's the whole group. You're just ignoring it because you want submission. You want everybody just to submit to your will, do as you're told, despite the evidence, the large body of scientific evidence that says naturally acquired immunity does work, is an important part of how we're all going to recover from this. So's the vaccine. But when you add them together, we're at a much different place than if you ignore them. 100 million Americans, by conservative CDC estimates, have had the disease. 200 million or more now have been vaccinated. It's a good thing. Combined together, it's how the disease is. Nobody wants to get the disease. We're not advising anybody to get the disease. But if you're unlucky enough to get it, think of the nurses and doctors and orderlies who all bravely took care of COVID patients. There was no vaccine for a year and a half. They took care of people, risked their lives. They got it, survived, and now people like you are arrogant enough to say, you can no longer work in the hospital because you've already had the disease. We're going to force you to take a vaccine that the science does not prove is better than naturally acquired. That's an arrogance that should be chastened.
Thank you. Senator Hassan.
Well, thank you so much, Chair Murray and Ranking Member Burr, for this hearing. I want to thank both Secretary Cardona and Secretary Becerra for being here today to discuss this important issue, keeping our students safe and in school. And I just want to note at the top here that as the mom of a young man with severe disabilities, I am particularly grateful for Senator Casey's questions about what we're doing to help students who experience disabilities. It's not just that, of course, they need their the individualized education plans met, but it is also true, just as you pointed out, Secretary Cardona, that often school is the only place that some of these students can get certain kinds of services. In some cases, that may be physical therapy, occupational therapy, speech and language. And when schools are also prevented from taking public health measures, these students often are also the most at risk for severe complications from COVID-19. So it's a catch-22 for parents. And I just want to thank Senator Casey and all of you for everything you're doing to help protect children with disabilities. Secretary Cardona, I wanted to start with a question to you. In addition to the teacher shortages many have discussed, schools in New Hampshire and across the country are struggling to fill other openings, ranging from paraprofessionals and social workers to bus drivers and custodians, roles that are essential to keeping our schools open for in-person learning. Some school districts are addressing these workforce gaps in various ways, including with hiring bonuses and paying parent drivers to help get kids to school. Secretary Cardona, how can school districts use their elementary and secondary school emergency relief funding to meet these staffing needs in order to keep schools open and provide essential support to students?
Thank you for the question and for your comments about students with disabilities and families and the importance that they are in our schools, and we should be prioritizing that as we think about reopening, as we should about ensuring that we address the workforce gaps. Safely reopening schools means we have enough staff to keep everyone safe and supported. So we do believe the American Rescue Plan and the ESSER funds can be used to make sure we're paying a salary that's competitive. People have options now, and I can tell you firsthand that my own children's experience is being influenced by whether or not they're able to get bus drivers to take them to extracurricular activities. So it is a real situation, and if we're serious about reopening schools and making sure our children have the best opportunity to engage not only in the classroom, but extracurricular activities or getting to school on time, we have to make sure that we're addressing these workforce gaps boldly. There are more funds now available to our districts to address that. But we also have to invest in pipeline programs to make sure that our dedicated paraeducators have access to programs to become teachers themselves. I'm really excited about the opportunity in the Build Back Better agenda to make sure that we're investing in our profession, paying livable wages, and making sure we create pipelines with incentives for paraeducators and other educators to go in, to get their teaching credential, to serve as special education teachers, bilingual teachers, and other shortage areas. It's all hands on deck. I think we have the right policy, and we need to make sure we're making bold decisions to let that happen.
Well, thank you. I want to turn now to the issue of learning gaps. One report estimates that due to COVID-19 school closures last year, elementary students were about 5 months behind where they would typically be in math and 4 months behind in reading. If not addressed, these gaps in learning will have a long-lasting negative effect on the lifelong success of students. So, Secretary Cardona, how can schools most effectively identify the gaps in student learning, and how is the Department of Education ensuring that schools have what they need to do this?
Thank you. Yes, our students missed out on a lot in the last year and a half. Academic gaps based on the fact that remote learning doesn't compare to in-person learning are significant. And the reality is some students faced more of it than others. It exacerbated opportunity gaps that existed. We recognize this, and we also, part of our return to school roadmap, prioritized not only safe school reopening and engaging in social emotional well-being, but also addressing the lack of instruction that students were not able to access due to the pandemic. We released strategies for using the American Rescue Plan funding to address the impact of lost instructional time as its own guidance document, in addition to the 3 handbooks that we have that address learning loss. Learning loss could be controversial. I don't want to victimize our students. It was a lack of access to instruction. Right. So we have handbooks out there. More importantly, we're talking to states to see what they're doing. And I was fortunate to see summer school programs that tripled in size, after-school programs that are happening because of the American Rescue Plan Fund. So they're working on that, and I know it's a priority for educators across the country.
Well, thank you. And Madam Chair, I realize I'm a little over. I just do want to point out that the department was very helpful to school districts in New Hampshire as they tried to use the secondary school emergency relief funds to improve air quality and ventilation in schools. And I look forward to submitting a question about how school districts can access those funds and work with the department to make sure their schools are safe. Thank you.
Thank you. Senator Cassidy.
Thank you all. Thank you for being here. First, I associate myself with Senator Paul's remarks as regards the need for our CDC to look at the influence of natural immunity and its effectiveness relative to a vaccine. And I agree totally that when we tell Americans that natural immunity does not confer immunity, that goes against the science. I'll say that. Some of his other remarks, perhaps not so much. But on that, absolutely. So, Secretary Becerra, if you can take that back to CDC, et cetera, I would appreciate that. Secretary Cardona, I think we can agree on this. Would you accept that the primary purpose of a school is the educated child?
Yes.
Or should be, shall we say, should be. Yeah. And we know there's, by the way, social services we don't want to ignore. My concern is during the pandemic, against science, public schools were much more likely to close. I'm looking at data from and by the way, if we're going to look at what empirically works, if we're going to follow the evidence, and the primary goal is to educate a child, I think we have to look more broadly than, say, just the use of masks. I'm looking here from something from your shop, Institute of Education Services, ies.ed.gov, and it is showing me that nationally, public schools, only 47% were open in January of last year. Catholic schools, 89%, and private schools, 92%. There is also significant disenrollment from public schools as parents sought to have their child educated, even though they were being kept shut upon the insistence of some teachers' unions, against the science, against the clear recommendation of, among other things, the American Academy of Pediatrics. There has been a hostility among Democrats, frankly, and among the administration as regards charter schools. Seeing how charter schools actually, private vouchers in charter schools actually give an alternative to a parent who is otherwise locked into a system that will not literally educate her child, why is there this hostility towards this alternative for the parents?
Thank you, Senator. I do agree with you that school reopening was critically important for all students across the country, and I'm very pleased to say that across the country, our schools are open.
Yes, but we're really
Students have
talking
access
about a
to
period of
in-person
time,
learning.
an extended period of time, where children lost a significant amount of their education. And by the way, this is about social justice, because it was the minority child in the intercity school that did worse by far. With some saying that 7 months of learning was lost among African American children on urban children, and 6 million, 7 months for the low income and 6 months for the African American child. And so why are we holding our parents and our children prisoners to a system that ignored their educational needs when the science showed that the schools could safely reopen?
Thank you for that question. I remember last spring and even before that working on reopening schools. And what I can tell you is those schools where predominantly black and brown students attend were woefully underfunded. And they didn't have the funding to address the ventilation systems, to address some of the basic needs.
Now Secretary Cardona, are you going to tell me that that inner-city parochial school that some philanthropists had opened up for these children, that was an older facility, did not have similar problems, but somehow did not attempt to adapt? I find that, I just don't believe that.
Okay, what I'm sharing with you, sir, is my visits, my experience as a commissioner, talking to superintendents, visiting schools with ventilation systems that weren't touched for 20 years, with class sizes of over 25, 26. We make sure that the schools are safe for students and for staff. And many of these same families were sharing their concern about schools not being reopened. I'm very thankful for the funding that the federal government provided to safely
I'm almost out of time,
schools.
I apologize. That may be the case. By the way, my wife is a chair of a board of a public charter school, full disclosure. They managed. They just opened up their gymnasium. They just converted their lunchroom. They made it work for those children who disproportionately are minorities. But why shouldn't the parent have the choice to take her child elsewhere if she decides, well, it may be that they have a lousy ventilation system, but they have a good ventilation system, and so I'm going to take my child to the private school with a good ventilation system so that my child doesn't lose 7 months of education this year? Why should she not have that choice?
Senator, it's my belief that all children should have access to a safe school and one where all children can succeed. And it was important that all schools be given the tools and the resources.
So if they're to, I'll finish with this, if they are to have access and defying science, unions demand that a school close, why would that access not include the ability to take dollars that would go to the public school, they're not open, they're not there for the kid, to take the child to a school which is open? Can you tell me, should that parent, just yes or no, should that parent have the right to take their child?
Well, it requires more than a yes or a no. It's more nuanced than that. But I will say, we have been working closely with educators, including our unions, to safely reopen schools. And today, all of American students have an opportunity to learn in person safely because of the work that we've done together.
That is papering over a terrible loss of educational opportunity for those who are most vulnerable in our society. And frankly, our perception is it is due to obsolescence to teachers' unions, not because of putting children first. I yield back.
Thank you. The vote has been called, and I'm going to go over and vote and return right away. The next three senators in order are Senator Smith, Senator Romney, Senator Baldwin.
Thank you, Madam Chair, and thank you very much, Secretary Cardona and Secretary Becerra, for joining us today. It's very good to be with you. I'm going to direct my questions to Secretary Becerra. Mr. Secretary, I applaud the Biden administration's commitment to keeping our children safe in school through vaccinations, through masking, through ventilation, and through testing. And this includes the administration's recent announcement that they will ramp up the production of rapid COVID-19 tests and purchase $2 billion worth of rapid tests, which can detect, as we know, up to 98% of cases that are infectious with COVID. So rapid in-home tests are a huge benefit to parents because they can get quick test results, so they know whether they can send their students to school after they've been exposed to COVID in the classroom. And it's also a huge help to schools that are, frankly, I've heard overwhelmed in some cases by asking educators to administer tests and to do contact tracing and on top of everything else that they're doing. Rapid tests are a better alternative than lab-based tests, which can be so frustrating to Minnesota parents and students as students are pulled out of school and activities are put on hold for the days while they're waiting, the 3 days while they're waiting for results. And I know that I believe both Senator Murray and Senator Kaine has raised this issue. As we know, unfortunately, rapid tests are difficult to get a hold of right now. So here's my question, Secretary Becerra. Some policy experts believe that by reclassifying rapid COVID-19 tests as a public health tool rather than as a medical device, that this could help unlock a greater supply of tests while also reducing the price of those tests. So could you talk to us about how the administration is thinking through this recommendation?
Senator, thank you. Thank you, Senator, for the question. And I know this is on the minds of many people, not just here in this chamber, but at home as well. As I mentioned before in responding to some of the previous questions, we have the tests. It's that getting them to the right source at the right time has been difficult. We are now coordinating in far greater ways with our state and local partners. Whereas before it was at the point of contact where the test would be made, that the request could be made for those types of tests. What we're trying to do now is coordinate far better how all of this is done. And what I will tell you is that between the money that was made available through the supplemental appropriation that you all passed, through the money from the ARP, we've been able to provide substantial funds, $10 billion in one case, $2 billion, as you just mentioned, more recently. Another $2 billion was made available to try to make sure that we're reaching everyone. Can we coordinate better? We're going to try to do that with our local and state partners. We at the federal government don't have the capacity to be the administrators of the tests, but we can work in partnership with those on the ground who can do it to make sure that we go where the tests are needed.
And do you think that there is an opportunity to think about reclassifying these tests? I mean, how do you?
That's certainly something we could take a look at. I can get back to you as quickly as possible, talk to the team to find out if that's at all something we could consider.
Thank you. I'd appreciate that. I think that there is an opportunity there, given the high level of accuracy and just as another tool that the administration could have as you are working to ramp up these tests. Yeah. So.
We've been using every tool you all give us, and we'll look at this one as well.
Thank you very much. I also want to ask you a little bit about the work that we need to do to support students with disabilities, particularly in the context of what has been happening with COVID. Pardon me, this is I should have said, Secretary Cardona, this is directed towards you, pardon me. This is about supporting students with disabilities as we navigate through what has been such a difficult time as in schools. And in particular, I just want to quickly highlight a couple of aspects of support for students with disabilities that we are seeing in my home state of Minnesota. There's many great examples, but recently we've seen educators from Moorhead Public Schools in Northwest Minnesota. They've shared with me how they've been able to make really important investments for their students using American Rescue Plan dollars, thanks to American Rescue Plan dollars. So, Secretary Cardona, could you just quickly, in the few seconds I have, discuss the department's approach to supporting education of students with disabilities and mitigating the learning loss that they've experienced?
Thank you for the question and for the support of the great programs there, thanks to the ARP. You know, we're back. Kids are back. Kids are back in school. That's the best thing we can do for our students with disabilities and all students. They're back in their classrooms with their teachers, with their peers. So the best thing we could do for students with disabilities is the same thing we could do for all students. Get them back in the classroom with those teachers that love them, that want to support them. However, for students with disabilities that might have had interrupted learning, it's really important that we're monitoring where they are today, not where they were in March 2020, and make sure that we're using American Rescue Plan funds to provide enough resources, enough support personnel to give the students what they need today, and to make sure that their families feel supported as the students transition back. Thank you.
Thank you very much, Secretary Cardona. And next up, we have Senator Romney.
Thank you, Madam Chairman. Secretary Becerra, I'm going to clear up a social media rumor that you spend most of your time outside of Washington, D.C. Is the majority of your time spent in, the great majority spent in Washington, D.C.?
In many ways, I would say, unfortunately, yes, because I still have a home in California as well. My wife is still in California.
Spend your time here. It's great. Let me turn to another topic. I concurred with Senator Paul, his concern about natural acquired immunity with regards to COVID-19. And I was disappointed in your response. I had expected you either to say one of two things. One, that the science is clear that inoculation adds to one's protection against COVID-19, and that he was wrong about the studies he described. He said every single study said that natural acquired immunity is better than vaccination, or at least as good as. Or I expect you to say, look, maybe it's the same, but we can't determine whether people have had COVID necessarily or not, and therefore we're, out of an abundance of caution, we're insisting they be vaccinated. Could you please get back to the committee with an answer to his question so that we can know where the science stands and where the administration stands? Secretary Cardona, I note that as young families are thinking about having children, they consider the plans for what it will mean to have a child. And they consider about pre-K, about child care, about college expenses down the road. And I note that in the President's plan, the so-called reconciliation bill of $3.5 trillion, that the plan is that child care and early learning expire after 6 years instead of 10 years of the full program, that pre-K expires after 7 years, and that community college coverage expires after 5 years. Do you think that young parents should therefore plan on these programs disappearing in 6, 7, and 5 years as proposed under the administration's legislation?
Thank you, Senator Romney, for the question. We're at a point in our country's history where we have the opportunity for transformational change for our students and our families.
I totally agree. I don't want to go on a different topic here, which is the transformation. Is this a permanent change? Or it's transformation if it's permanent, but if it's just temporary, 5, 6, and 7 years and all these programs go away, that's not transformational, that's bait and switch.
Well, Senator, I do believe at this point the families, especially post-pandemic, providing community college access, that only helps the economy, and that would help.
But should it expire at the end as it is planned now at 5 years?
I'm hopeful, Senator, that today goes really well for our families across the country, and that in the coming years we'll find ways to continue to support those strategies that we know lift American families.
You mean it's your anticipation that these programs then, that parents should count on them continuing?
That is the goal, to have community college access for all families.
If that's the goal for all these programs, not the 5 years, 6 years, and 7 years that's in the legislation, how are you going to pay for it? Because there's only one of two ways, either more debt or higher taxes. Which do you prefer?
Well, Senator, I know that in this proposed budget, no one making under $400,000 will see an increase in taxes. But I will tell you,
well, that's right away. But if you're saying that down the road, when these programs are set to expire, you'd expect them to continue instead, then that means any promises about not raising taxes on people making under $400,000 a day, those are going to expire as well.
As a lifetime educator, I can tell you what's being proposed is transformational for our families.
I agree it's transformational. I'm not sure it's transformational in the right way. I'm concerned, for instance, that we're going to double the child tax credit, which allows people to help pay for child care. At the same time, we're going to give them free pre-K for 2 years. Why double? Why give people free pre-K and double their child tax care credit, which they could use themselves to either decide to care for their own children at home, to go to Head Start, to go to a private child care facility? Why do we have to both double the child tax credit and at the same time provide free pre-K and, by the way, build new school classrooms to do so?
Sir, for me as an educator, early childhood education is a foundation for a strong educational program.
Totally agree,
I've
but why
seen
do we
the
have to pay
benefit.
for it twice?
I've seen the benefit of it, and I know for many of these families, their ability to get back to work and add to their income is
Look, I'm perfectly happy with providing funding to families so they can provide child care for their child. I think they ought to have the choice of, one, providing it themselves if they want to, either with a family member or a spouse, or number two, sending a child to a child care facility of their choice, but to say you're going to do that, and we're also going to give you public school child care. That's two programs, doubling the cost, and it's taking away the incentive for people that might choose to decide to have the child care for at home. I think my time is up. I'm sorry, Madam Chairman. Back to you.
Thank you, Senator Romney. Senator Marshall.
Okay, thank you, Madam Chair, and again, thanks to the secretaries for being here to talk about the intersection of health care and education, something that's near and dear to so many of us. If we talk about the highest causes of death for your students, for our students, it's accidents or trauma. Suicide is number 2, homicide is number 3. Cancer might be going up or down depending which age group we're talking about. But focusing this morning for me is on the emotional health and the impact on the suicide rates from COVID as well as our policies. That's what I want to focus on today, and especially what our mandates do to the emotional health of our children. I turn to the conversation of natural immunity just for a second. Look, I've seen the data. All the moms out there have seen the data on natural immunity. And I'm telling you, these mama bears are going to protect their kids. They don't see the benefit of a vaccine for something their children are already immune to. And there are risks associated with the vaccine. And don't get me wrong, I've had the vaccine, my parents the vaccine. I hope my parents get their booster soon. I'm in favor of vaccines. But when we're talking about our children and those ones that already have immunity, I think that many Americans have concern about this and the emotional impact if those kids get kicked out of school because of this mandate. I think you both would acknowledge that getting kicked out of school has a huge stigma to it. And if this is my question for you both, yes or no? If the CDC would acknowledge natural immunity and a child has antibodies, would you consider excluding them from the mandate? Let me say that again. If the CDC would acknowledge natural immunity and a child has antibodies, would you consider excluding the child from the mandate? Secretary Cardona, yes or no?
Thank you, Senator. This issue requires more than a yes or a no. I know states and local districts are the ones making decisions around masks and vaccines, and I'll rely on them. What I've done, because I'm not a medical doctor, is rely very heavily.
And that's what my question
guidance.
is. So if the CDC acknowledge it and a child has antibodies, would you support excluding that child from the mandate? Think of the emotional impact of that child being kicked out of school for something they're already immune to and the suicide rate. Secretary Becerra, can you answer the question, yes or no?
Senator, you'll be disappointed, Senator, to know that. You're going to be disappointed, Senator. I was about to say you're going to be disappointed to know that it's not a yes or no answer because science doesn't act as quickly as you'd like on those answers. What I can tell you is that we have looked at the science, we have looked at some of the studies and the data, and for example, in the state of Kentucky, with regard to children, there was a study that showed that for those, actually individuals, not just children, people who were unvaxxed, who had COVID, showed that they were twice as likely to be reinfected with COVID than those who had been vaccinated.
Yeah, so we can argue about the studies all day, and I'm a physician, you're a lawyer, and you probably don't want to go down that road. Because I'm telling you, the huge majority of the studies show that natural immunity is better than the vaccinations. A huge majority, and let's don't talk just about getting the virus, let's talk about hospitalization, about morbidity and mortality. And your jobs, neither of your jobs is to decide what, if the statement is true that I'm saying, that natural immunity is better. That's up to the CDC. So my question was, if the CDC would acknowledge it and a child has antibodies, would you excuse them from the mandate? But we need to go on. I'm very concerned about migrants coming across the border carrying infectious diseases as well. Probably over 3 million migrants have come across the border illegally, legally, and many of which are children. I'm very concerned about not just the COVID and the variants they're bringing, but tuberculosis. Haiti has the highest incidence of tuberculosis in the Western Hemisphere. Measles, mumps as well. And what are you two going to do to A, to test those children before they get into our schools, and B, to make sure that they get their immunization? Secretary Becerra.
Senator, great question. And we do, as you know, have jurisdiction over some of those migrant children who are unaccompanied. And we have jurisdiction over them once they are turned over to us by Customs and Border Protection. We make sure that no child is placed in any setting, whether it's in our congregate care or in a licensed care facility or in the hands of a responsible custodian, without first making sure that they are free of COVID and they've had a vaccination. And so we make sure that no one, whether it's a U.S. citizen or anyone coming into this country, can infect someone else.
And I'm sure you're measuring that somehow, some way. Secretary Cardona, anything to add to students entering to our school systems that have not been tested or properly immunized?
All students, including non-citizen students, have access to meals, to education, and any healthcare needs that they have to make sure that they're healthy.
But there's a huge difference between access and it actually happening, right? I mean, we have to be just overwhelmed right now, our systems do, our schools do, with these children. 12,000 Haitians recently have been turned into the United States, and I want to share compassion and love with those folks. I've done mission work in Haiti. I've been to the border. I understand the humanity of all this, but I also don't want my grandchildren exposed to tuberculosis, let alone new variants of COVID. Thank you, Madam Chair, and I yield back.
Thank you. Senator Baldwin.
Thank you, Madam Chair. I'm ambitious in hoping that we can get to 3 topics in my 5 minutes, all related to how your 2 departments are working together with resources provided in the American Rescue Plan. I want to start with mental health services. Senator Casey earlier brought that up with you. As we do reopen schools and recognize the mental health toll that the pandemic has had on our nation's youth and families, I think there should be a focus on making mental health care more accessible in schools, including by promoting and expanding the availability of school-based mental health programs. I'm certainly working with the chair of this committee in our other joint committee appointment on the Subcommittee on Labor, HHS, and Appropriations to emphasize and elevate funding to expand school-based mental health programs in Wisconsin and across the country. Can you talk about how your agencies are collaborating to expand access to mental health services in schools, and what else you need from Congress in order to advance this effort? And start with Secretary Cardona.
Thank you very much for the question. And I'll be brief because I know you have 3 topics, and I know my colleague here wants to speak. Thank you for bringing up the importance of social emotional well-being of students and the fact that we have to build back better. We can't go back to how it was before. Our students have been traumatized. I would argue that before the pandemic, we should have been doing more. The collaboration has been great. I recently had a road trip, and Dr. Vivek Murthy, the U.S. Surgeon General, joined, and we were talking about the importance of mental health access. I visited a high school where they're restructuring their day to provide mental health access and social emotional well-being for 6,000 high school students. in the ARP, funding is there for that. The $1 billion in the Build Back Better agenda, I have to mention, to double the number of social workers, school counselors, and then the importance of community schools also to make sure that outside agencies are coming in. I can continue. It is a priority. Our return to school roadmap has that as a priority. We're going to continue to do that.
Great. Secretary Becerra.
Microphone, oh, there we go. It wants to go. Senator, I'll just simply add, the Department of Education and HHS's CDC have been working closely together to make sure that we're using the data properly together. We're constantly working to make sure that we're informing school districts as best we can what the science is telling us, and so they're working together very closely, and that's a good sign. As I mentioned to you before, we've made historic investments in mental health and in substance use disorder as a result of the work that you all did to pass the American Rescue Plan. And I will mention something very important, not just between departments, but within my own agency, because we're so large and we have so many agencies that touch mental health. I established a coordinating council within HHS to make sure that we're all working together, SAMHSA, Administration for Children and Families, so that we're not missing anything. We're working together and working with our sister departments.
The second topic I wanted to mention is the funding for testing in the American Rescue Plan. I am encouraged by the administration's efforts to follow the science, but unfortunately, conventional testing, especially in schools, has come with challenges. We've heard about some of them this morning, and we need to make sure we're advancing innovative approaches to keeping our kids and teachers healthy. At the University of Wisconsin, we're working on a proposal to expand surveillance of respiratory viruses, including COVID-19 and influenza, by collecting air samples from schools. Unfortunately, they've been struggling to access funding from the American Rescue Plan because entities in the state are focused on funding conventional diagnostic testing. How are your departments working together to evaluate innovative approaches to testing that might be very beneficial to schools and school settings? And will you commit to providing states with the flexibility they need to expand and enhance testing, including through innovative proposals?
So I'll start off by saying, yes, definitely we recognize the importance of testing and accessibility to testing, surveillance testing for our students. That's how we keep our schools safe, and that's how we're going to keep our children in the classroom, which is a priority for all of us. We've seen great examples in Rio Rancho, New Mexico, New Orleans, Louisiana, Louisville, Kentucky, and what we're doing is lifting up best practices. One of the sites that I visited with Dr. Murthy last week was a Access Family Center where they provided testing, and they partnered with the schools. So we went to see that firsthand to see how it worked, and we want to make sure we're promoting best practices to educators across the country.
Senator, I'll just simply add that along with working together department-wide, we've also provided about $10 billion through CDC directly to the school districts, the states and school districts, so they can start doing the testing they need. We continue to provide technical assistance, collaborating with them, trying to give them the guidance they may need to know how best to use those resources, and we're ready to do more.
Thank you. I'll state the last question for the record, and you can follow up, but I wanted to know how your agencies are collaborating with experts in industry in the ventilation space to ensure that the improvements supported by the American Rescue Plan funding are designed and installed and maintained in a way that promotes health and minimizes illness among students, teachers, and staff.
I'll have my staff follow up with you. Thank you.
Thank you.
Thank you. Senator Tuberville.
Morning, gentlemen.
Morning.
Morning, sir.
Good to see you all. Secretary Becerra, been hearing a lot, of course, people in Alabama and all across the country. Everybody's ready to get back to their normal life. I know you are too. Specifically, our teachers. I'm hearing from a lot of teachers. We've been in full class most of the last year and a half in Alabama. But teachers are concerned. They're concerned that they know they're going to get exposed. There's no way around it. But they want to know that they've got an effective means once they get sick. Example, I had a teacher write me a letter about She got sick, and she goes to the hospital, real sick, but they turned her back because there's no monoclonal antibodies. Alabama hospitals have had a pretty good supply over the last couple of, I'd say 4 or 5 months of the antibodies. Secretary Becerra, why did the HHS take over the supply chain of monoclonal antibodies just in the last few months? Can you give us a good reason?
Senator, thank you for the question, and I'm glad you asked because this is something on the minds of a lot of folks. We have seen a tremendous increase in the demand for these monoclonal antibodies. Let me give you an example. In your state of Alabama, in July, your state ordered, all those providers ordered a total of 6,800 doses. In August, your state ordered over 45,000 doses. In less than 2 months, it went up that quickly. And your state wasn't the only one. The difficulty is that with that immediate surge, trying to meet that demand became complicated. So what we've done is we have surged with that to make sure that we're manufacturing more. We're working with industry to make sure that they continue to manufacture more. But what we thought was important is to make sure that every state, Alabama, as any other state, had access to those monoclonal antibodies. So what we did is rather than let those therapies be secured on site by anybody on site, we decided to let the states decide how to best coordinate that. So that state would make sure, Alabama would make sure that every Alabama would have access to those monoclonal antibodies, not just at one place in one part of Alabama. And so the formula for that distribution is public, your staff, and you have that. And so we would ask you to take a look, because what we're trying to do is have transparency guide how we make sure those therapies and those treatments are available to all.
Yeah, it's my understanding in the second quarter this past year that we had a huge contract with 2 companies with monoclonal antibodies. And when they're ready to deliver, we said we don't need them. This was in April. And I just want to know who in the world would turn those down in this time of need. It doesn't make sense. Now, they came back and gave us a lot of them because we went back to them, the companies, and they said, well, luckily we've held some of them, but then we had to crank it back up. Who would make that decision?
Well, so remember, the request for the use of the monoclonal antibodies was coming from the places at home in your state. And we were making sure that we were providing the distribution to make it possible to do that. And so we were meeting the needs until these last few months when the Delta variant really surged, and all of a sudden a lot of people were getting sick, especially in certain states. By the way, 7 states are right now essentially taking in about 70% of all those monoclonal antibodies. Of the 50 states, 7 states. And so you can see the surge has occurred quickly. And what we're trying to do is make sure that the manufacturers are producing the supply that's needed. We're trying to make sure that the distribution is done fairly, equitably, and it's done transparently. And that there's accountability as well, because we don't want to find that an Alabaman goes without that monoclonal antibody because somebody else got it and shouldn't have.
Yeah, and you know, we're so fired up about the vaccine, and I am too. I've taken it, and it's not going to keep you from getting it most of the time. It's going to keep you from getting real sick, and I think everybody can agree with that. But we need to focus more on therapeutics. I don't think there's any doubt about, and testing. I've talked to a lot of doctors, especially in the school systems. We need to be testing almost every day or every few days. Kids before they come. Now, they can have the virus, and if we wait till they get symptoms, they've had it for 2 days and they've already been in school and it's been exposed. I just hope, you know, I heard you say about equity, and I continue to hear everybody talk about equity, and I believe in that. But we need to save people's lives. We can't shut down Alabama or some of these other states simply for the fact that we might not be taking as many vaccines. We cannot let people die, and especially teachers. You know, we're telling them to go back to school, and they want to go teach, but we can't do that. So I'd hope that we would not get political with this. Red states, blue states, it shouldn't even be about that. It should be about everybody. If they need it, they get it. And we just need to be more prepared. So,
absolutely agree.
Secretary Cardona, I got some questions for you, and I'm going to put it on record, Madam Chair. But thank you. Very good answers. Thank you, and look forward to hearing from you. Thank you.
Thank you very much. Senator Lujan.
Thank you, Chair Murray, and thank you to our distinguished witnesses for being available today. Several studies have found that mask usage dramatically reduces the spread of COVID-19, including one of rural schools in Wisconsin that found mask wearing reduced the spread of COVID-19 by 37%. Secretary Becerra, do you agree that wearing masks in schools reduces the spread of COVID?
Senator, I think the evidence now is overwhelming that good mask policy helps keep people safe, making sure that even if you are vaccinated, you continue to use masking policy if you're indoors. Makes sense, especially for our kids, because we have kids under the age of 12 who are not vaccinated. And so there's no doubt that the studies, the evidence, the science has shown us that masking works.
And Secretary Becerra and Secretary Cardona, I'm going to ask you a series of yes or no questions, and I'd ask for you to try to get through them quickly, as I have several others. Is the best way to keep schools open to deploy proven health measures like masks and testing? Secretary Becerra?
Follow the science and the data that's helping us keep people safe, yes.
Sounds like a yes. Dr. and Secretary Cardona, sorry.
The last year and a half have proven yes, mitigation strategies work.
Yes or no, does banning localities from implementing public health measures undermine the effort to reopen and keep schools open? Secretary Becerra?
Senator, we have to use common sense, and we have to do everything to keep our kids safe. And we would want to make sure we're using the different treatments and therapies and strategies that keep our kids safe. And masking, vaccines, distancing, ventilation, hygiene, all that works, and we should be able to do all of those. And why should any parent not be able to do those?
Secretary Cardona?
The reopening data is pretty clear. In places where they're more relaxed about mitigation strategies, they're 3.5 times more likely to have spread, which results in school closures.
Does banning localities from implementing public health measures disproportionately impact students with disabilities and underlying health conditions? Yes or no, Secretary Becerra?
Senator, folks with disabilities, kids with disabilities are more vulnerable, therefore more susceptible to COVID. We have to do everything we can to keep them safe. And the most effective way to do that is all the different strategies that I just mentioned.
Secretary Cardona?
Students with disabilities are disproportionately impacted when poor policies are implemented.
Yes or no, has disinformation on masking and vaccine on tech platforms negatively impacted the response to getting kids back into the classroom? Secretary Becerra?
Again, the science should guide us, the facts should guide us, the data that shows where to go should guide us. Not social media, not politics. And so I hope that families who are concerned for their kids' safety at school will follow the science and the facts.
Secretary Cardona?
Yeah, we're focused on sharing, following the science and communicating that in different platforms to make sure that our families are getting accurate information.
Recently it was announced that YouTube is going to stop allowing disinformation videos on vaccine and COVID. I applaud them, and I hope the other social media platforms follow them. Turning to the effective use of relief funds, New Mexico school districts reported that the elementary and secondary school emergency relief program, ESSER, and CDC control of emerging infectious diseases funds are critical lifelines. With the recent doubling of teacher vaccinations in New Mexico, school worker shortages are one of the main reasons for school closures in my state. I'm proud that my state took bold steps of investing $38 million in the American Rescue Plan ESSER 3 funds to stand up a teaching fellows program to strengthen the teacher pipeline into New Mexico schools. It also invested $10 million to increase the number of school-based mental health counselors. ESSER funds are also building a more equitable education system by helping schools to close the homework gap. Secretary Cardona, what other innovative uses of ESSER funds have you seen from states and districts that have kept our schools open and made education more equitable for long-term?
Just last week, I visited 5 states in 5 days on a back-to-school road trip where I was able to see firsthand how our students are happy to be back, our teachers are happy to be back. We're back in business because of the American Rescue Plan and the funding from the federal government. And I've seen ventilation systems improved. I've seen students having access to school social workers, parents having access to support in the schools. I've seen better professional development. I've seen students in summer programs that are intended to get students to re-engage after a year and a half of being in front of a screen through the use of the American Rescue Plan funds. And I've seen colleges also engaging students in different ways, creating new pipeline programs, all because of the American Rescue Plan. I'm fortunate that I get a bird's eye view and I get to visit schools across the country and see the amazing things that are happening as a result of the American Rescue Plan. And our students are fortunate that they have educators that are committed to meeting their needs when their students come back. Many great things happening in our schools today.
Appreciate that. And Chairman, I do have some additional questions in the area of in-person learning and mental behavioral health with students, but I'll submit those to the record. Again, I thank the witnesses for being here today.
Thank you. Senator Collins.
Thank you, Madam Chairman. Secretary Cardona, I think all of us can agree that students suffer when they're not in school. And in order to avoid another year of learning loss, emotional turmoil, and behavioral problems, some school districts are implementing a test-to-stay approach. And what they do is they allow asymptomatic students who test negative for the virus to stay in school rather than quarantining them after another student or a staff member has tested positive for the virus. A recent study in The Lancet suggests that the test-to-stay approach can be safe. There was a randomized trial that included more than 150 schools in Britain that found that case rates were not significantly higher at schools that allowed close contacts of infected students or staff members to remain in class with daily testing than those that required at-home quarantine. So if our goal is to keep schools open, it seems to me that we should be looking at the science. Yet, despite this evidence, the CDC has said that at this time, they do not recommend or endorse a test-to-stay program, even though the consequences are that thousands of students in this country are once again not in school because of quarantining. So my question to you is, do you agree with the CDC or do you agree with the Lancet study and those school districts that are using a stay-in-school and testing method?
Thank you, Senator, for the question and for communicating the importance of in-person learning. That's the best way we can get the students the support that they need after this year and a half. And I recognize that there is emerging data or studies around this test-to-stay. To be very frank, since the beginning of the pandemic, we've worked closely and listened to the science of CDC, and it's helped us safely reopen schools. So we're going to continue to work with the CDC, and as their guidance changes, we'll implement at the school. But we are going to rely on our health experts who have guided us to the point where we're reopening schools across the country for all students.
Well, the problem is that the guidance from our health experts over the past year has been conflicting and inconsistent. And that heightens the distrust in these institutions at the time when the public needs to be able to rely upon them. And I think the latest example of this confusing, conflicting advice has to do with the booster shots. And that will lead me to my next and final question for Secretary Becerra. At FDA, the longtime director of the Office of Vaccines Research and Review and her deputy are leaving this fall, in part because of the decision-making over boosters. This weekend, the CDC director commented and conceded the confusion in messaging around who should receive the booster And this was after she overruled the recommendation of her own advisory committee. Two public health experts from Brown and Harvard wrote in the New York Times that the new federal recommendations go, quote, well beyond the data. So how can HHS better ensure that public health agencies in this country at the federal level truly are following the science and produce a consistent, reliable message?
Senator, thank you for the question. Let me put it this way. COVID does not run a linear course. And as we've seen now with Delta especially, it is wily. It can dodge, it can get around, and it can be strong and fast. And we have to try to keep pace. We have to wait for the science to give us the direction on where to go, where to turn. And I go back to what was said earlier, we have to use our common sense. I believe that Director Walensky used the science and common sense to decide how best to make sure we keep Americans safe with regard to boosts in her latest action. And I think FDA has done a tremendous job with the science that is also evolving with the variant to make sure that we keep Americans safe. The evidence is in. If you've been vaccinated, chances are you're not going to die. You're probably not going to be hospitalized. If you're unvaccinated, in fact, 99% of people dying today are unvaccinated. And so I think between FDA, CDC, all of our different agencies, NIH and others, we've done the best we can using the science to guide us and staying within the framework of the law.
Thank you. Thank you. Senator Hickenlooper.
Is there here that I'm missing?
You had it. No, try one more time.
Still trying.
I think
That's working.
Pull it closer.
you'll see a
Well, there's usually a little light.
You're on, you're on.
But anyway, I feel good. All right. Apologize for the delay. Thank you both for your service. Thanks for answering all of our questions in what are clearly difficult times. Secretary Cardona, I'm going to start with you. Obviously, we've seen drops in enrollment. Colorado, we saw a drop in enrollment of 9%. That's 7,000 students. I wanted to see if it's possible to, what are the ways we can try and recapture some of those students, and if it's possible to give students the freedom to explore or the flexibility to explore alternative methods, and such as the example, if climate allows, providing the tools for students where it's appropriate to actually learn outside.
Thank you for the question. Disenrollment has been an issue, and there was one study, Bellwether Education Partners estimated 3 million students across the country. That's significant. And we know that our students that maybe were underserved by our education institution are more likely to be students who are disenrolled. So our priority is to get students back into the classroom, to knock on doors, to make sure we're doing everything in our power using ARP funds to create programs that didn't exist before, to re-engage families and students, get them the support that they need. Part of this is data. We're requiring chronic absenteeism data to be reported from states, especially if they've received accountability waivers. We're expecting more information on chronic absenteeism to make sure that we're focusing on those students that not only were impacted by the pandemic, but haven't returned to schools. We've provided at least 3 handbooks updates with strategies on how to get those students re-enrolled. And I have to tell you, last week, I listened to examples and I saw some examples firsthand of what is happening across our country. We have programs in different states where there are teacher corps now going out, knocking on doors, getting students back into the classroom. There's a LEAP program in Connecticut that has social workers knocking on doors. In Ohio, I was introduced to a teacher leader there who spent time over the summer knocking on doors, bringing students back in, because students are more likely to engage when they see someone they know. And then with the outdoor instruction, we know one of the innovative practices that came out of last year was learning outdoors. And this is a practice that I hope continues when we reopen our schools. Students enjoy it more, and we know they learn better when they're outdoors and with their peers. So that's a strategy and an innovation that I hope to see continue in our schools.
Great, and thank you very much. And I have seen, you've been everywhere all over this country, so I give you tremendous credit for putting it at a time when it was so needed. You were out there serving America, and really appreciate that. And I say the same thing about Secretary Becerra. You've also been all over this country. I want to ask you, as Chairman Murray and other members know, I've been focused on trying to get sufficient funding, full funding, for pandemic preparedness. The Biden administration called for $30 billion to invest in research, manufacturing, the infrastructure, right, to create a library so we're prepared for whichever of, I think it's 25 families of virus the next pandemic comes from. We've seen estimates that when you average it out over 100 years, the cost to society is in the hundreds of billions of dollars per year. And yet for over 4 years, for $30 billion, we could make sure that we could get a vaccine within 100 days, not 320 days like this past time, which was a miracle, but within 100 days. Anyway, I wanted to see if how an investment like this allows your agency to succeed.
Senator, first, I think the comments I'm hearing are not just those of a senator, but of an executive, someone who ran a state and has to be thinking ahead of the curve, right? And that's what we're trying to do. We're trying to get ahead of the next pandemic because we know something will follow COVID. And so we're trying to make those investments now. We're making sure that all of our agencies, whether it's CDC or FDA, NIH, they're thinking beyond what we know. That's where this ARPA-H funding that we're requesting will take us to the next level where we'll coordinate with the private sector far more closely, be nimble, and do the things we need to do. We're going to make sure that the supply chain, we work on that to make sure we never have a situation again where we don't have enough masks. All those things, we learned a great deal. COVID, as bad as it's been, taught us a whole lot, but we do need people who have that mentality, as you just mentioned, as an executive, thinking, what's next, versus just waiting till it happens.
Thank you, and I appreciate that it's one thing to learn the lesson, but making sure that we put it into the lessons we've learned into practice is, as you point out, equally important. Anyway, thank you for both of you for your service. I yield back to the chair.
Thank you. Senator Murkowski.
Thank you, Madam Chairman, and Mr. Secretaries, thank you for being here. Appreciate it. Important discussion here this morning. Many of my colleagues have touched on some of the issues that I wanted to raise, and so rather than try to repeat, let me go into a couple different areas. Obviously, this past year and a half, we have really learned the benefits of distance learning. How we're able to connect virtually. While it's not the ideal, I think we recognize that it has helped to facilitate learning, and particularly in some very remote areas. My state is one where we have many parts of the state that are either unserved or certainly underserved, and it has made distance learning very much a challenge. In certain areas, that underserved comes about because the cost for internet, the cost to deliver broadband to these communities is prohibitively expensive. You can have a family that's paying $800 a month to receive their services, their internet, and it's slow and it's cumbersome. It doesn't work for anyone. We have, I think, done a lot to address this inequity that we know exists within access to broadband. The bipartisan infrastructure bill is another great example of the work that we continue to do there, but we know that it's going to take time to build up this broadband capacity to connect communities and homes. The FCC has been working on a rule to allow schools to use their E-rate funded broadband to basically beam the instruction into students' homes. The FCC, as I understand it, has not yet finalized this rule. So to you, Secretary Cardona, are you working with the FCC to encourage them to get that work finalized? Do you know where we are in that? Because as they say, daylight's a wasting.
Right. Well, thank you, Senator, for bringing up the importance of making sure our rural communities also get the support that they need. This pandemic did impact rural communities greatly, and broadband access was really difficult to come by. We've spoken about this, and I recognize the challenge that it is for students in your state to access learning online. Our agency is working with FCC to try to move the process along. I can have someone reach out to you with updates so that you have more up-to-date information.
I would appreciate that, because I'm getting those requests, and I don't have anything to definitive to provide them at this point in time. Another concern that I'm hearing is, all right, we've got lots of money for tests, whether it is for the rapid tests, whether it is for the tests that you are able to get and take home. But having access to federal funding doesn't necessarily mean that you can find those tests. And I am hearing not only from schools, but I'm hearing from businesses that are worried about this mandate that's coming out of the administration that says either get vaccinated or do testing, but there's no place to get the testing, or certainly not to get the rapid test. So you've indicated in response to Senator Smith's question, Secretary Becerra, that we've got the tests out there, but it's difficult to get them distributed. I don't know whether that is just within the schools, but you need to know that right now there is a real crush to be able to get the testing that can get the results back in a timely enough manner to make a difference. Right now, you go into the Anchorage International Airport, where I get tested every time I land, and there are no rapid tests that are available. They say it's due to a national shortage, is the sign that they have posted. So where are we? How can we assure people that if you want the test, whether for work or for school, we can't just say we put lots of money out there. We need to know that it's actually getting out to folks.
Senator, and I think you'll agree that we've seen the surge in these last couple of months. Delta has really been the driver of all this.
Alaska's #1, and we don't want to be #1. Yeah. We are in a very, very, very challenged place right now.
And by the way, before I forget, I want to make sure that I mention that we're getting ready to move forward on telehealth rulemaking, and which might interest you as well. I know that broadband is an issue, but telehealth, we could talk about that later. But what I'll tell you in terms of testing is that FDA has moved forward to try to provide as many different type of testing opportunities as possible. I think it's now up to some 400 different types of tests that could be made available. We're trying to work closer with the industry, the manufacturing base, to make sure that they know what supply will be needed. We're trying to coordinate far better now with the states and local governments. We're trying to let the states help us determine where the test should go, rather than just let people in any part of the state or any part of the region of the country to dictate where those tests should go, so we make sure there's always sufficient supply for every state. And so it's one of those things where we have to work in close partnership with our state and local teams to make sure that we're coordinating well, because in some places there's enough supply. In others, as you just mentioned, it's not. And so we have to make sure we coordinate very well.
Well, I think we recognize that we're going to be dealing with this, living with this, having this in our schools for a lot longer than any of us would like. And so the availability of tests and the affordability of tests and the quick turnaround of tests is going to have to be made a priority. Thank you, Madam Chair.
Thank you. Senator Kane.
Thank you, Madam Chair and Ranking Member, and thanks to our witnesses. And I want to follow up on Senator Murkowski on this, because it's the one thing that everybody on this committee agrees on. You know, vaccination, there's sadly political turmoil about it. I wish there wasn't. And masking, there's political turmoil about it, and I wish there wasn't. But everybody here in this committee thinks there ought to be a lot of tests and they ought to be cheap. And Secretary Becerra, I want to follow up with you on this, because when you said there's adequate supply, there's distributional problems. That may be true, but it's not true that there's an adequate supply of affordable tests. So the cheapest test, that rapid COVID test you can buy over the counter right now in the United States, is an Abbott Binax Now, and that's basically $12 a test. They come in 2 packs. And the second cheapest is a Quidel QuickView test, and that's $15 per test. In Germany, you can get a rapid COVID test at the grocery store less than $1. In India, a rapid COVID test at the grocery store is $3.50. The UK provides 14 free tests to everybody in the United Kingdom. The studies have shown that adults, if the tests are like $1 or $2, they'll get tests to make sure they can go to work, or they'll test their kid to make sure it's safe for them to be at school. But if it's $15, the willingness to regularly test yourself dramatically goes down. And so since I think there's bipartisanship on the issue of we ought to have tests that people can afford, why are tests in the United States so much more expensive than in countries like Germany or the UK or India? And what are we doing to make sure that the costs are costs that people can afford?
Senator, great question, and I'm not sure I can give you the full answer, but here, let me give you a shot at giving you something. Remember that Germany, some of those European countries have a federal system that lets them move much faster than we do. We have a system, a republic that allows the 50 states to dictate so much of this. And as I just mentioned, some states prepared better, some states didn't. And what we're trying to do is coordinate far more with them. Among the billions of dollars that you all made available to us in supplemental appropriations and the rescue plan, there's about 43 billion that you made available for testing. 10 billion, by the way, of that was specifically for schools. I mentioned earlier that President Biden has called for another $2 billion to help make sure that the industries are manufacturing sufficient supply of the tests. So we're trying to do everything we can to make sure the supply is there. We're trying to work, as I mentioned earlier to Senator Murkowski, we're trying to work closer with our state and local partners to make sure that we coordinate better so we can make sure we're hitting the spots that need it most and we're never running out of supply.
I'll probably ask this for the record or maybe at a follow-up hearing, but I would like to hear what your metric is about not just supply, but what the cost should be to somebody who goes to a pharmacy to buy an over-the-counter test. Because again, if the research shows that people will get tested if it's $1 or $2 or $3, but they won't get tested if it's 15, they won't regularly test, well, we can have all the supply we want. If the cost isn't affordable, then people aren't going to take advantage of it, and then one of the 3 legs of testing, vaccination, masking, the one that we agree on, we won't be able to accomplish. And we ought to be able to accomplish the one we agree on. So I would hope to maybe get some metrics from y'all about, in the President said we use the Defense Production Act to expand supply. I hope you have a metric about affordability in there, and I'll follow up on that. I just want to say really quickly, Secretary Cardona, good to see you. I'm really worried about teacher shortages and school shortages generally, school bus drivers and guidance counselors. And my city of Richmond, my hometown, 435 vacancies at the start of the school year, just a couple weeks back. It's been a very difficult time for teachers. So what are y'all doing in DOE to kind of put your arms around that problem and focus upon teacher recruitment and retention and teacher preparation? Because I think this is a challenge all across the country.
It is. Thank you, Senator. We're reopening schools was the goal. Children are back in school, we're back in-person learning, but there are so many other needs that we have to focus on now. And the teacher shortage was exacerbated during the pandemic. What we need to do is make sure we're being creative and innovative with programming to allow for recruitment programs and pipeline programs. We have educators, paraeducators, climate specialists, liaisons in our building. We have to work with our higher ed to make sure that there are clearer and quicker pathways to get into the profession. I saw a great program at University of Wisconsin-Madison where they're doing that. They have folks that are interning and then getting a job in the school for a master's. So there are funds available in the agenda to help accelerate this, especially in special education, bilingual education, and some of the other shortage areas. But we really have to make sure we're also elevating the profession by providing the supports that they need, ensuring teachers are safe, let's start there, and making sure that we're promoting the profession as a viable option and that teachers are getting a livable wage as well.
Senator Collins and I have a bill called the PrEP Act that is very focused upon increasing new pathways into the profession and attracting more people, and I think it would accomplish some of those goals. Look forward to working with you on that. Thank you, Madam Chair.
Senator Braun.
Thank you, Madam Chair. I have 2 questions for Secretary Cardona and 1 for Secretary Becerra. I know you're in Indiana recently, and schools across the country are trying to reopen, and my travels, everybody's trying to do it safely. It's different, every school corporation. And I know that some of those meetings are a little rowdy. In this case, I think discussion was on mask mandates, curriculum related to maybe critical race theory. And I think that civic engagement, I was on a school board for 10 years. And I always tell people, you'll get an earful of something. It'll be a good indication whether you're ready for something else. But I was a little disturbed, and I want to see if you really meant the comment. And it was in relation to why are they doing this? And I'm going to quote this. And your response for that engagement was, I think it's a proxy for being mad that their guy didn't win. And I'm quoting it verbatim here. And I know you probably didn't mean that, and I'll give you a chance to retract it. Is that something you'd want to take back?
I know that across the country, our school board meetings are a little bit more intense, but I'll tell you, school boards are unwavering in their support for returning students to school and providing a safe learning environment for
What about the statement? And I agree with you 100% there. Would you want to take that back to not politicize something where I think it's an honest, sincere difference of opinion across the country? And I don't know that I'd want to be on record with that.
Senator, I'll tell you, the lack of civility in some of our meetings is disappointing and frustrating, especially because our superintendents and educators and board members, and you should know you're a board member, they've worked tirelessly over the last 18 months to provide a safe environment.
And I know it can get rowdy, and I'll take it that you don't want to retract it at this point.
So rowdy, it was very dangerous in some places.
Indiana has led the nation in school choice, and it's something that coming through the pandemic, I think it's clear that parents, again, ought to be the drivers of the equation. I think parents from K through 12, and especially with them that have had kids pursue a 4-year degree and they end up in the basement with an unmarketable degree, need to have more say-so. They pay the bills through property taxes, then tuition, room, and board. Fairly quick answers here because I want to get to Secretary Becerra. Do you think parents should be in charge of their child's education as the primary stakeholder?
I believe parents are important stakeholders, but I also believe educators have a role in determining educational programming.
And I think that's going to be a little out of focus, what I think you're going to find across all elements of education. Since they pay the bills, they raise the kids, they probably need to be the primary spokespeople for their own kids' good education. Should parents have more school options, including private schools?
As I said in previous hearings, I believe public education schools should be the first and best option. The neighborhood school, children want to be in their neighborhood school, but parents should have options, and I believe they do across the country.
So I think it sounds like you'd think there might need to be more options. I came from a great public school system. I think competition and choice always exceeds any of the other things when you want to get real quality at something. Should the money follow the student, or should it follow the school?
I believe education systems should have strong schools for all students, and I believe we need to make sure we are investing in public schools, because for some students who that's their only option, we need to have that be a high-quality option for all students.
Thank you. Secretary Becerra, we've been navigating through this saga of fighting the coronavirus, which has been challenging in many respects. The baseline of fighting it have been vaccines. Some countries are under 10% vaccination rates. We can see variants come from there normally. What's your opinion on making it maybe a tripod of therapeutics and prophylactics? And I know Pfizer is out there, I think, addressing a real market need, that we not only keep doing what we're doing on vaccines, but we put equal emphasis on curing it once you get it and preventing it in the first place. What do you think?
All of the above, Senator. And
when are we going to start pushing it from this level to where we give resources and emphasis in a more broad-based approach?
Well, I think at HHS we've been doing that because the fact that we're able to meet so much of the demand these days for therapeutics is a sign of that. But I want to make sure we remember that it's all of the above. And as my mom used to always tell me, mejor prevenir que remediar, better to prevent than to remediate. And so therefore masking, social distancing, all those things that prevent us from getting sick and therefore needing the things that keep us from dying are the most important things we can do.
Very good. I'm glad to hear you're on board with a broader approach of remediation and protection from it in the first place. Thank you.
Thank you.
Well, I want to thank the witnesses. There being no additional senators who have to question, this has been a really important hearing. Both the information that's been put on the table and other questions that I think will come and follow up will help us do our work. I want to thank my colleagues for their thoughtful questions, and then Secretaries Becerra and Cardona for the work that you're doing at a really challenging time and for having this conversation with us. Look forward to working with you both as we continue to help students, families, educators, both get through the pandemic, but also grapple with the challenges that we discussed today so that our schools can get stronger. And many of the issues like testing that we discussed are about schools, but they're also about the workplace and quality of life in the community. Any senator who wants to ask additional questions should get those questions in for the record in 10 business days on or before October 15th at 5 p.m. The hearing record will also remain open for any members who wish to submit additional materials for the record. The committee will next meet on October 7th in this room, Hart 216, to consider the nominations of Lisa Gomez to be the Assistant Secretary of the Department of Labor's Employee Benefit Security Administration and Jose Javier Rodriguez to be the Assistant Secretary for the Department of Labor's Employee and Training Administration. The committee stands adjourned.
Thank you.